I'm Dr. Maunika SV from SPARSH Infantry Road, and the topics today we'll be discussing about heart attack, the heart failure, the treatments for it, and the surgery part. And here we have Dr. Chirag, consultant cardiologist, and Dr. Ashok Kumar, consultant cardiologist, and Dr. Rohit, consultant cardiac surgeon. So Dr. Ashok, nowadays we are hearing a lot about the heart failures. So what exactly is a heart failure?
So basically, heart is a muscle pump. Its function is to pump blood that it receives from all over the body. So basically, the heart muscle pumps and ejects the blood that it receives. So when there is a problem in the heart's pumping or in receiving the blood, so this leads to heart failure. It can be either a pumping failure or a problem in receiving the blood, filling problem. The heart fills and then pumps. So when there is a problem in the pumping or in the filling, it results in heart failure.
So what are the causes of heart failure?
There are various causes of heart failure. The most common causes are previous heart attacks. Patient had a heart attack earlier. As a result, the heart muscle got damaged and the heart's pumping has come down. Normally, the heart pumps at least 60% of the blood it receives. Commonly, it is measured as ejection fraction. So when the ejection fraction comes down, so this is called as heart failure with reduced ejection fraction. So the most common cause is previous heart attack. There are various other causes where the muscle itself becomes weak, something called as a cardiomyopathy. The heart muscle disease where inherently the heart muscle becomes weak. Patients with hypertensive heart disease, hypertension, untreated or undertreated hypertension, patients with diabetes, and patients with various other muscle diseases. All these can cause heart failure. Also, patients with valvular heart disease, patients with valvular leaks, mitral regurgitation, aortic valve disease, all these can also cause heart failure. Rarely nowadays we don't see them. So some deficiency of vitamins can also be a rare cause of heart failure. But most common, all said and done, the most common cause is the previous heart failure, heart attack.
So what are the symptoms of the heart failure and how common is it, sir?
Yeah, the most common symptoms are breathlessness. Patients have breathing difficulty. Patients cannot complete the task which they were comfortably doing before. Any activity, any exertional, any activity that demands higher level of exertion will cause breathlessness. So this is the most common symptom. Other common symptoms include fatigue, exertional fatigue, lightheadedness, increase in the weight gain secondary to edema. So there can be fluid accumulation in the body causing a weight gain. So these are the other common symptoms of heart failure.
So what are the treatment options available now, sir?
So mostly the treatment is through medications. So predominantly the treatment modality will be a medical treatment for most of our patients. So initially patients need to be decongested. Whatever the fluid that is accumulated in the body has to be removed. So there are medications to remove the fluids from the body and make the patient feel better, make their breathing better. And the other treatment options include medications to improve the heart's pumping. Fortunately, there are a lot of treatment options available. It's an ever evolving field. New medicines come every other year, and we have a whole basket of treatment available for heart failure patients.
So what is ICD, sir?
So ICD is it's called as AICD. AICD is an automated implantable cardioverter defibrillator. This is a pacemaker therapy where a heart failure patient is put on an ICD coil, which is basically a pacemaker positioned in the patient's chest wall with a lead in the heart, the tip of the lead in the heart. So these patients, heart failure patients, run a higher risk of sudden cardiac arrest. So to prevent this happening, so this ICD helps. ICD is basically a coil that delivers a shock. It is like going with a defibrillator machine wherever the patient is. It is a miniaturized defibrillator machine which delivers a shock appropriately at a time and saves the life of the patient. This purely is for prevention of sudden cardiac death. It doesn't improve heart's pumping, it prevents sudden cardiac death.
And what is the role of transplant, sir?
So heart failure evolves gradually over a period of time, and there is a period of time when the patient reaches a stage called advanced heart failure. Advanced heart failure is when there is no reversibility of the problem. So the patient reaches a stage where the symptoms cannot be managed with medications, available medications, and where the patient starts gradually worsening. It can be in the form of unresponsiveness to the routine therapy, or periods of repeated hospitalizations, the need for hospitalizations, the patient's blood pressure may drop, the renal function may worsen, the patient may develop multi-organ dysfunction. So at this stage, this patient is said to be in a stage of advanced heart failure. So the treatment options for advanced heart failure, one among the option is a transplant. So these patients are subjected to a procedure called right heart catheterization study and then listed for transplant. So these patients usually do not respond to conventional therapies, and the only treatment option left over for them would be a transplant. So based on the right heart study, they have to be listed for transplant and wait for an organ to come in for a transplant. So transplant is the last option for patients who have reached the advanced heart failure stage and no more medical therapy is left over for them.
Thank you so much, doctor.